Tubes in My Ears, My Trip to the Hospital by Virginia Dooley, illustrated by Miriam Caden. Hi, my name is Luke. Did you ever wonder what going to the hospital is like? Well, I was in the hospital and this is what happened to me. It started last month. I got a bad cold and then my ears really started to hurt. I knew I had another ear infection. My mom took me to see Dr. Kim. She examined my ears and told me I needed to get tubes in my ears because I have had so many ear infections. I thought she meant the kind of tubes you put in bicycle tires. Then she showed me what tubes for ears look like. An othroscope is an instrument doctors use to examine the inside of the ear. Ear tubes help stop the pressure that builds up in the ears when they get infected. Ear tube, actual size. A week later, my mom and dad took me to the hospital to get the tubes in my ears. We had to get up really early and I wasn't allowed to eat or drink anything. I didn't even brush my teeth. Not eating or drinking keeps the patient from throwing up and choking during the operation. When we got to the hospital, we had to wait and wait. I was so hungry my stomach started to growl. I started to feel a little scared too. At last someone called out, "We're ready for you, Luke." A nurse named Claire weighed me. Next she took my temperature. Then she wrapped a band around my arm to check my blood pressure. The band squeezed my arm really tight. Claire also listened to my heartbeat with a stethoscope. The stethoscope felt icy cold on my chest. Finally, I changed into funny pajamas with elephants all over them. They opened in the back and made me feel kinda silly. Then I met Dr. Riviera. He told me he was an anesthesiologist. He explained that I needed to be asleep when they put the tubes in my ears. An anesthesiologist is a doctor who puts patients into a deep sleep before an operation. That way they will not feel any pain. Mask for receiving medicine. Luke, would you like to breathe medicine through the mask or get medicine in a needle to help you fall asleep? He asked. I picked up the mask, of course. A surgeon is a doctor who does operations. Next, Dr. Rice came in. He said that he was a surgeon. He shook my hand. It made me feel very important. After Dr. Riviera helps you fall asleep, he explained, I'll put the tubes in your ears. You won't feel anything. Soon it was time to go to the operating room. I wasn't allowed to walk there, so I got to ride a bed with wheels. My mom and dad came with me. Dr. Rice told them that they could stay until I fell asleep. Dr. Riviera, Dr. Rice, and two nurses came into the operating room. Everyone was wearing special clothes and masks. Even my mom and dad. I started to feel a little scared again. Doctors wash their hands very well and wear special clothing in the operating room to keep the patient from getting germs. A machine called a heart monitor makes sure a patient's heart is beating regularly during an operation. Dr. Riviera said everything would be okay. Then he put the mask on my face. He told me to count to 20. I started counting. 1, 2, 3, 4. That's all I remember. I fell asleep before I even got to 5. When I opened my eyes, I couldn't remember where I was at first. Then I saw my mom and dad right by my bed. I knew I was back in my hospital room. I was glad the operation was over, but I felt sick. I had a tube in my arm. The nurse told me the tube was letting sugar water into my body to make me feel better. Glucose in a bag. After an ear tube operation, some patients need sugar water or glucose to help them get stronger. The glucose goes into the body through an IV or intravenous tube. The tube attaches to a tiny needle placed in the patient's hand or arm. But I didn't feel any better. Instead, I threw up, and my ears and mouth hurt. Finally, I felt good enough to drink some juice. The nurse said that if I drank a whole cup of juice and didn't throw up, I could go home. I drank the juice slowly to make sure it stayed down. Dr. Rice came and looked at my ears. "You're doing great, Luke," he said. "You're ready to go home." The nurse took the IV tube out of my arm. I got out of those funny pajamas as fast as I could. I was glad I didn't have to stay overnight. Going to the hospital really wasn't so bad, but going home was a lot better.